Hi, everyone. My name is Ayla Kaminsky, and I'm a nursing student at Mount St. Joseph University. And today I'm going to be talking about virtual reality therapy as an intervention for patients who are receiving end-of-life care. These patients often experience pain, anxiety, and depression. And while medications like opioids and antidepressants are commonly used, they can cause significant side effects. So this has increased interest in non-drug options like virtual reality therapy to support patient well-being. And my project is guided by the PICO question. For clients receiving end-of-life care, does the use of virtual reality therapy compared to pharmacological, like opioids and antidepressants, improve levels of pain, anxiety, depression, and overall well-being? The background of my project is that virtual reality therapy immerses patients in calming environments like nature scenes, travel experiences, or guided relaxation. Research shows that virtual reality therapy can reduce uncomfortable physical symptoms, existential crises, and emotional distress. It offers a safe option for patients who want fewer medications or cannot tolerate the side effects. Virtual reality rarely causes more than mild nausea, but while it shows short-term benefits, more research is still needed on the long-term effectiveness. Now let's get into the specific findings of my summary of evidence table, starting out with the first study, Persing et al. This study discusses depression treatment in the end-of-life population. The key findings are that depression in the end-of-life population is up to 70%, and the majority of medications did relieve depressive symptoms. They did find that non-pharmacological methods like guided relaxation, cognitive, and emotional therapies were also effective to reduce depression and anxiety. The nursing implications of is that nurses should routinely assess for depression and not normalize low mood in this population. Nurses should also support patients in getting the treatment that they need. The second study, Hedman et al., discusses opioid effectiveness in treating pain in end-of-life care. Overall, it found that opioids are effective in relieving pain, with 78.4% of patients experiencing complete pain relief and 21.4% experiencing partial relief. But in some conditions like COPD and cancer, pain relief was challenging to reach with just opioids. So the nursing implications of this is that even though opioids are an effective first-line treatment for pain, some patients dislike the side effects or physically they can't tolerate them. And in these cases, therapy like virtual reality would be very useful. The third study, Maloney et al., discusses patient outcomes after virtual reality sessions. The key findings are that virtual reality therapy helped reduce physical and psychological symptoms like pain, fatigue, shortness of breath, depression, and anxiety, and it even improved appetite. 48% of the patients would use virtual reality therapy again, and 53% chose the highest satisfaction rating. So what this means for nurses is that overall patients really do enjoy virtual reality therapy, and some will need emotional support afterwards, just in case it evokes a negative response. The fourth study, Huang et al., explores how virtual reality therapy causes symptom improvement. They found that the underlying mechanism to reducing these negative symptoms is distraction and reducing mental burden. One quote that I really found interesting from this study is, in virtual reality, higher levels of openness, more greenery, blue skies, and sunlight exposure yielded higher levels of recovery from perceived depression, anxiety, and stress. Huang et al., 2024. The nursing implications of the study is that nurses should really help patients customize their virtual reality experience, and the therapy can cause motion sickness, so patients should be monitored throughout. The last study, Liu et al., examines short-term effects after therapy as well as caregiver response. The key findings are that social anxiety is decreased, mood and energy is improved, and participants enjoyed more meaningful connections after the virtual reality session. Also, caregiver burden was decreased. The nursing implications of this are that nurses should assess a patient's physical and emotional readiness for the therapy. They need to tailor the virtual reality to the patient's unique needs, and they should also recognize that it can reduce their workload. So let's go ahead and move on to the pros and cons to just kind of summarize everything in the evidence table. So for virtual reality, the pros include that it is a non-pharmacological intervention, so there are fewer severe side effects. It can reduce pain, anxiety, depression, shortness of breath, and improve appetite, mood, and social interaction. It provides a personalized, meaningful, and memorable experience, and it reduces caregiver burden. The cons include motion sickness, limited staff training, lack of access due to costs or supplies, and it may not be appropriate for patients with delirium or who have significant cognitive impairment or physical restrictions. As for pharmacologic fit therapy, the pros are is that this medication is very well established. They're effective and they often are an essential part of symptom management for patients. However, the cons include that they have serious side effects like sedation, respiratory depression, constipation, or nausea. And they do not address the emotional and existential crisis and distress. And some patients just prefer fewer or no medications during this time in their life. So, how would nurses implement this in practice? Nurses should help to personalize virtual reality therapy to match the patient's preference, and they need to ensure safety with the proper headset placement, a clean and secure environment, and they have to monitor the patient for adverse side effects. The sessions should really begin briefly and then build up over time and length, and nurses should assess for emotional or physical discomfort, especially during a reminiscence-based therapy. And finally, nurses should evaluate the overall response and look at the patient's comfort, mood, symptom relief, and evaluate if virtual reality is beneficial moving forward. The barriers to implementation include limited research, physical or sensory impairments, motion sickness, cost of equipment, time constraints, lack of staff training, and low technological literacy among patients. In conclusion, virtual reality therapy is a promising complement to traditional medications for end-of-life care. It helps to improve emotional well-being and physical comfort. And while medications remain essential in treatment, virtual reality can address additional emotional and sensory needs. They can ease symptoms like shortness of breath and pain, and potentially reduce medication use overall. Although challenges like limited research, cost, staff training, and patient tolerance exist, virtual reality still offers a meaningful potential as a holistic, personalized treatment in end-of-life care. All right, that is my presentation for y'all. Thank you very much for listening.